Understanding your body and taking charge of your health is an important part of growing up. One of the key ways girls and women can care for themselves is through regular health exams, such as a Pap smear. But what exactly is a Pap smear? Why do doctors recommend it? And what happens during these exams? Let's walk through everything you need to know about Pap smears and other important female reproductive health exams. A Pap smear, sometimes called a Pap test, is a simple medical procedure that checks for changes in the cells of your cervix, the lower, narrow part of your uterus that opens into the vagina. The main purpose of a Pap smear is to screen for cervical cancer and to help catch any problems early, often before you ever notice symptoms. Pap smears can also detect changes caused by the human papillomavirus, or HPV, which is a common virus that can lead to cervical cancer over time if left untreated. So when do you need a Pap smear? Health experts generally recommend that girls start getting Pap smears at age 21, regardless of whether they are sexually active or not. After your first test, your doctor will tell you how often you should return for follow-ups, which is usually every 3 years if your results are normal. For some women, especially those with certain risk factors, your doctor might recommend more frequent screening. Remember, Pap smears are just one part of taking care of your reproductive health, and your doctor can help you decide what's best based on your individual needs. Let's talk about what actually happens during a Pap smear. It might feel a little nerve-wracking if you've never had one before, but knowing what to expect can make the experience much easier. The Pap smear is usually done as part of a routine pelvic exam, which means your doctor will check the health of your reproductive organs, your vagina, cervix, uterus, ovaries, and fallopian tubes. When it's time for your Pap smear, you'll be asked to lie back on an exam table with your feet placed in footrests, called stirrups. Your doctor will gently insert a special instrument called a speculum into your vagina. The speculum helps to hold your vaginal walls open so your doctor can see your cervix clearly. You might feel some pressure or a little discomfort, but it shouldn't be painful. If you ever feel pain, let your doctor know right away. Next, your doctor will use a small, soft brush or spatula to collect cells from the surface of your cervix. This part of the exam only takes a few seconds. The collected cells are then placed on a glass slide or in a special liquid and sent to a laboratory, where they're carefully examined for any abnormal changes. After the test, you can get dressed and go about your day as usual. Most women don't feel any after effects, though some might notice a little spotting or mild cramping. Waiting for your results can make anyone anxious, but it's important to remember that most Pap smears come back normal. If your test shows any abnormal cells, it doesn't automatically mean you have cancer. In fact, most abnormal results are caused by minor infections or changes that resolve on their own. Your doctor may recommend more frequent monitoring or additional tests, such as an HPV test, or a more detailed exam called a colposcopy. Pap smears are only one type of reproductive health exam. Let's talk about some of the other important exams and screenings that help keep girls and women healthy. A pelvic exam is a broader checkup that's often done at the same time as your Pap smear. During a pelvic exam, your doctor will look at and feel your reproductive organs to make sure everything seems healthy. This exam helps to identify signs of infections, cysts, or other conditions that might need treatment. If you ever have symptoms like unusual discharge, pain, or bleeding, a pelvic exam can help your doctor figure out what's going on. Another important screening is the HPV test, which checks for the human papillomavirus. HPV is the most common sexually transmitted infection and can lead to cervical cancer. Sometimes, your doctor will do an HPV test at the same time as your Pap smear, especially if you're over 30. The test uses the same sample of cells from your cervix, so you don't need a separate procedure. You might also hear about STI, or sexually transmitted infection, tests. These tests look for infections like chlamydia, gonorrhea, and others that can affect your reproductive health. Some STIs don't cause symptoms, so regular screening is important if you're sexually active. STI tests may involve a urine sample, a blood test, or a swab from your vagina or cervix. If you're ever unsure about which exams you need, don't hesitate to ask your doctor. They're there to help you understand your body and to make sure you're getting the right care for your age, lifestyle, and health history. Taking care of your reproductive health isn't just about exams and tests. It's also about understanding and listening to your body. Pay attention to any changes, such as unusual discharge, pain, itching, bleeding between periods, or discomfort during sex. These symptoms don't always mean something is wrong, but they're worth discussing with your doctor. It's also helpful to keep track of your menstrual cycle, noting when your periods start and end, how heavy your flow is, and whether you have cramps or other symptoms. This information can help your doctor spot patterns and offer better advice. If you're nervous about these exams, you're not alone. It's normal to feel a little uneasy, especially if it's your first time. You can always bring a trusted friend or family member to your appointment, and don't be afraid to ask questions or share your concerns with your doctor. They want you to feel comfortable and empowered. Remember, Pap smears and other reproductive health exams are an important part of staying healthy at every stage of life. These tests help catch problems early, often before you notice any symptoms. Early detection means easier treatment and better outcomes. Regular checkups are a sign of self-respect and care. Even if you feel healthy, these exams are your opportunity to make sure everything is working as it should. They're also a chance to talk to your doctor about anything that's on your mind, from birth control options to period pain, sexuality, or anything else. In summary, a Pap smear is a simple, quick, and important test that helps protect your health by detecting cervical cancer and other problems early. It's usually done as part of a routine pelvic exam and is recommended for all women starting at age 21. Alongside Pap smears, pelvic exams, HPV tests, and STI screenings are key tools in maintaining your reproductive health. Taking these steps, staying informed, and working with your doctor are all part of growing up healthy and strong. So, if you haven't had your first Pap smear yet or are curious about what to expect, remember, it's normal to have questions. Taking control of your health is empowering, and regular exams are a vital part of that journey. By learning about your body, keeping up with checkups, and speaking openly with your doctor, you're taking important steps toward lifelong wellness.